Yo, mi gente, what it do, man? It's your boy into the T-Bag Gator. Sorry I started a little late. I was trying to get on it, but I had difficulties. Today, Friday, June 3rd. Today's live, I won't be talking about exercises, mi gente, because we know that exercise is a big it goes hand in hand with us with MS. You know what I mean? Muscle, like they always say, muscle you don't use, you lose. And and to me, exercise has been like my number one, besides being therapy or whatnot. This has been my go-to cure, medicine, or what you want to say for my MS. Um, at the beginning of my videos, you see that I started off, I was on crutches, and this was back going. If you go back in my videos, you go to the most viewed video as about 37,000. I'm on crutches. And that's the way the whole thing started. Remember, I had a torn meniscus, and that's when I got surgery on my right knee. And from there, I got on crutches. But what was crazy is because I didn't know what was going on. I had the drop foot on my right leg, but I didn't know that it was due to MS. I didn't know I had a drop foot. I thought I just, something went wrong. Oh well, big on, let's keep on going. So I would have the crutches, and you see in the videos, I'm dragging both, my right foot, should I say? Then little by little, my left one started doing the same thing to the point that my hyperextension was so bad, and this was before the seizure, before the burns. My hyperextension was so bad that I would literally compensate and rely my whole body just to on that right hyperextension. Literally, I was using that like the hyperextension like it was a cane. And it helped me and it helped me stand up and move around, doing stuff like that. Like in the videos, you'll see I'm doing it with no cane, no nothing, because I was able to manage holding onto furniture, moving around. But that's not safe, man. That's not the right way to do it. But I didn't know. And then once everything got cleared, okay, this is what it is. And then I got diagnosed and told me that that is a drop foot, that I have it because of my MS. Nothing that can cure but regular exercises. So when I started going to PT, then it was just a regular inpatient, or outpatient therapies that lasts about 15, 20 minutes, half an hour, whatever. One would think that those little stretches that you do, or rather it's repeatedly, just like the ankle going up and down, moving your hands, rotating your necks, simple stuff like that, mi gente, you would think that they're not valuable, they're not beneficial for us, but they are, mi gente. At the long run, every little second, every little minute you put into it, you get credited back. But you got to do it repeatedly, mi gente. You just can't go ahead and do something and be like, you know what, this is what's gonna happen, or you know what, it didn't work out, so forget it. No, man, you got to keep on doing it. Remember, I've been diagnosed in 2014, and I'm since then I've been repeatedly doing therapy, doing exercises, whether it's OT, PT, speech therapy, all therapies that is possible is out there. I've been through it, man. And thanks to the Lord above, I keep getting better and better. But as with us, we know that. Sorry, I gotta clear my throat. I got a little dry throat today. If we don't do them as frequently, man, then we're never gonna get to that. We're never gonna get to that point where we want to, what we want to get to, should I say? Like a dope phrase, a quote from Albert Einstein said it best. Insanity is doing the same thing repeatedly and expecting a change. You know what I mean? And expecting a change. You can't just be doing nothing and expecting that something's gonna happen. Now you keep doing things, you keep moving around, doing stuff differently. Then you start noticing the end. You start seeing better flexors. You're bending your knee better. You're bending your toes. I mean your ankles. Everything starts working out, man. And once again, this is before the burns. I had the seizure. I learned how to walk again for that little bit, but then again, I'm holding on to furniture, with the hyperextension on crutches. Then when I suffer the burns, man, then that's when I really became wheelchair scooter bound. At first, I was bed bound. I couldn't move around. I couldn't do nothing, and it got so intense that literally I thought I was gonna. They even had told me I would have to bring a hospital bed to my house, so they can help with the hospital, but can help with the elevation. so I won't stay stuck in the same position and all that. That's how bad I was. And then when I got home and I noticed the situation, I was like, "Whoa, this is no good." So all of that's going behind my head, thinking that what, that's it. I'm not gonna be able to do it. But I kept kicking in with those exercises. I kept doing the exercises. I kept remembering all the little exercises they told me to do at the hospital, at the outpatient therapies, wherever I went to, and some of them are about the same. If you get the pages or the script and you see they're about the same exercises, but they help out. Then once I started getting to walk and I was and I noticed that I was able to walk myself, God showed me anything, man, for what was that for. I was hyped. I was like, okay, my body can hold my body up. I mean, my legs can hold my body up. That was my biggest fear. And once it did that, we just kept on doing therapy all day. Exercises, no matter how you do, like I said, I'm at home by myself 24/7. But I don't need nobody right there telling me what to do and how to do it. I know what I do. Yeah, I mean, I pay attention to where I go to, and so I start working out. I start remembering those things. Like I always told every therapist that always had me or had my case, I always told them, remember me, think of me as a student, not as a patient. You know what I mean? Because I come here to learn something that is a lifelong lesson, something that we do repeatedly, something that we do frequently, something that we're going to do the rest of our lives until it's done. Especially once again, anybody that suffers from any autoimmune disease, but us MSers, we know the way it is. I can't speak for anybody else, but I'm assuming that if it's the same thing, it's all about mind over matter and a lot of things. Man, that people think that I'm crazy when I say this, but it's mind over matter for a lot of situations because what I mean. When you put in your mind, what you get and you start putting all them. That's what I'm saying. Negative, no negative, niente, not thinking negative for no reason, or for any reason, should I say? We're on the verge of conquering and doing the impossible possible because we are possible. That's an Adidas commercial, but it's true. I mean, there's no stopping us from getting to where we want to get to. And like I said, man, I've been putting up these videos. I got so much videos of me walking and doing all these little things every now and then, every day or so. But these are little things that help out, man. And like I said, I don't gotta record. I don't put a video. I'm not here 24/7 with you guys on a video because what I mean. It's impossible to do that. So stuff that you guys don't see on the camera, that's the stuff that I'm talking about. That's stuff that I keep doing over here. Like, okay, then I gotta do that. I gotta put up videos. I got my gente watching me, so I gotta make sure I walk a little bit better. Remember, I got goals 2023 walking without a cane. And one of my mans that threw me up that code, that goal. So I said, let's go. But remember, I don't set goals anymore. I set growth. Why? Because goals, you do it and you accomplish them, you scratch them off, and that's it. It's off the bucket list. Growth, something you can't stop, something that keeps growing, something that keeps going. And that's your boy M to the T. I keep going. I keep doing what I gotta do. So yeah, so that's a little bit brief about about how important exercises are, in our situation, in our case. But not mi gente. I love you guys, miss you guys. Hope you guys get a little info on this. And like I said, never stop doing you. Keep pushing, keep trucking, because they say that there's no cure, but the cure we got is all up here. We get this straight, me and we ain't gotta worry about the rest. We got this. Love y'all, miss y'all. Let's go.